Lp(a) or lipoprotein A is a type of lipoprotein that is mostly genetically determined and can increase your risk of heart disease and stroke. The tricky part? Most people don't know their Lp(a) level because high Lp(a) often has no symptoms. Why does Lp(a) matter? High levels are more common than you might think. About 1 in 5 people have high Lp(a) levels globally. A high Lp(a) level may increase the risk of heart attack, stroke. Even if your other cholesterol numbers look good, Lp(a) could still be a hidden risk factor. Having high Lp(a) can lead to plaque buildup in your arteries, reducing blood flow and causing blockages. This may increase the risk of heart attacks and strokes. It is also linked to conditions like peripheral artery disease, or PAD, and aortic stenosis, which can make it harder for your heart to work properly. Heart disease and stroke risk are shaped by many factors, and Lp(a) is one of them. Lp(a) levels of 125 nanomoles per liter, 50 milligrams per deciliter, or higher may increase the risk of heart disease and stroke. And levels of 250 nanomoles per liter, 100 milligrams per deciliter, or higher may double that risk. Your doctor can explain what your level means for you and help you plan next steps. Who's most at risk? The biggest factor is genetics. If someone in your family has high Lp(a) levels, you might too. Certain groups like people of South Asian or African descent tend to have higher levels. Certain factors and conditions may also increase your levels, such as kidney, liver, or thyroid disease, and life stages like pregnancy or menopause. Although lifestyle changes don't lower Lp(a) levels, you can lower your overall risk of heart disease and stroke by eating a heart-healthy diet, getting regular physical activity, maintaining a healthy weight, avoiding tobacco products, and getting 7 to 9 hours of restful sleep each day. These habits lower other risk factors like high LDL, bad cholesterol, and high blood pressure. One of the biggest challenges with Lp(a) is that many people don't have symptoms. You could have a high level and never know it. That's why testing is important. If you have high Lp(a), making healthy choices and taking prescribed medications can help lower your overall heart disease risk. The Lp(a) test isn't included in a standard cholesterol test. You have to specifically ask your doctor for it. It is a simple blood test, and finding out your level early can help you take steps to protect your heart. Current guidelines recommend every adult be tested at least once in a lifetime. Testing may be especially important if you have a family history of early heart disease, if an immediate family member, like a parent, child, or sibling, has a high Lp(a) level, or if you've been diagnosed with familial hypercholesterolemia, or FH. FH is an inherited condition in which people may be born with very high LDL levels. The process of testing family members is called cascade screening, and it helps identify others at risk early so they can take steps to protect their heart health. Thank you all very much for listening to this lesson. We appreciate your time and attention. If you have any questions, you can ask your healthcare professional at your health center. And remember, your heart health is in your hands, so take control today.